Hello everyone. Welcome to Yashoda Hospital's online segment, the Health Talk session. We are here today to talk about the topic asthma. 1 in every 10 asthma patients in the world is from India. It is considered the most common chronic lung condition both among children and adults. So let's discuss on this topic about asthma. Do post your queries on a social media network and we'll get them answered shortly. I'm Dr. Lakshmi and let's welcome Dr. Nagarjuna, consultant pulmonologist from Yashoda Hospital's Somajiguda. Welcome, sir. So to begin with, what is asthma and how common is it in our country, sir?
Asthma is, I would say, probably the commonest health problem, not only in our country but across the world. The estimates, our national estimates itself, various studies have been done which have shown that the prevalence of asthma in both children and adults in our country is to the tune of 5 to 20%, which means that if we randomly choose 100 people, it is likely that 10 of them will be having asthma or would have had some form of asthma in the past. So what exactly is asthma? Asthma, to put it very simply, is a allergy of the lungs. So basically what happens in asthma is the airways means the tubes which carry the air from the nose to the lungs, they are called the airways. They become sensitive. So whenever they are exposed to any trigger, by trigger I mean something which doesn't suit their body, so these airways react. So when they react, they become narrow, and this leads to the symptoms of asthma. So very simply putting it, asthma is basically allergy of the airways of the lung.
So taking few questions from a social media network, we've got Mr. Prasad asking us from Hyderabad. He wants to know, is asthma hereditary?
Yes, asthma in majority of them is called as an intrinsic asthma, which means that there definitely seems to be a genetic predisposition, which means if the parents, either the mother or father or their family members, have allergy or asthma in their genes, it is likely that their children also will develop asthma. In fact, in our practice also, we would see that roughly around 70 to 80% of people whom we diagnose as asthma have this genetic predisposition. So to some extent I would say it is hereditary, but at the same time not in everyone. So there are around 20% of them in whom they don't have any genetic tendency, but then it develops because of exposure to triggers. So people who are chronically exposed to allergens from the childhood or during their occupation can also develop what is called as a extrinsic asthma or an occupational asthma.
So sir, at what age group is it mostly diagnosed?
Asthma is a disease which can start at any age. In a certain subset of people, asthma starts early in the childhood. We can have children who are diagnosed as being asthmatic even before 5 years of age, but then it is not necessary that all asthmatics do develop symptoms from early age. We have a lot of people whom we call as late onset asthma or adult onset asthma. So even though they're absolutely fine during their childhood, they can start developing symptoms later on in their life. And then there's one more group of people where the symptoms are there in their early childhood, and then as they grow the symptoms subside, and again later in their life, probably in their 40s or 50s, again the symptoms come back. That is called as a biphasic pattern. So asthma can occur at any age. It is again a misconception that asthma starts only in the childhood and asthma doesn't start in the adults.
Do post your queries on the topic asthma and we'll get them answered shortly. So moving to the next question, we've got Mr. Praveen from Warangal. He wants to know, what are the factors triggering asthma and how would one know about it?
So what exactly is a trigger? Trigger means something which will cause asthmatics to have problem or cause asthmatics to have their symptoms. So every person with asthma will have their own triggers. So it is we cannot say that everyone will have the same triggers. So only thing we can do is we can discuss the common triggers which majority of the asthmatics will have. So some of the common triggers include the environmental triggers. So in the environmental triggers, the commonest is the dust. So in anything which is related to smoke or dust or pollution will definitely trigger asthmatic symptoms in a majority of them. Second is the climate. So many asthmatics have problem during the cold air, cold climate exposure, or during the season change, the rainy season or the winter season. So this cold climate or the change in the temperature is one another common trigger for people with asthma. Then the other common triggers include pollen. Then there in India especially, you should also talk about what is the indoor air pollution, especially in the villages. A lot of women are exposed to what we call as the biomass fuels, that is the chula stoves, the wooden stoves and all those things. That is another common asthmatic trigger in the rural areas of our country. Similarly, farming. So people who are into farming, they can also have a lot of fungi in the fields which can trigger their asthmatic symptoms. So these are called as the environmental triggers. In addition to these environmental triggers, what is also important is the psychological triggers. So asthma is also called as a psychosomatic disease, which means that stress is another common trigger in asthmatics. Many asthmatics whom we see are also having a lot of anxiety, lot of stress, lot of fear. So all these negative emotions, negative things also can worsen asthmatic symptoms. Then the other thing which many people ask is food as a trigger for asthma. But then certain types of nuts and in some people milk products or seafood can sometimes trigger asthma symptoms. And lastly, there's also something called as an exercise driven asthma. In some people, exercise or physical activity also can trigger asthma symptoms. So in addition to these 4-5 common things, we should also remember smoking. Smoking is a very important trigger of asthma. Then having pets in the house is a very strong asthmatic trigger. And then lastly, some of the drugs. It's always important for us when a person with asthma comes to find out if there's any drug which can also worsen asthma symptoms.
So sir, are there any allergen tests to diagnose asthma?
The tests which we do and the real life triggers do not also actually match. So it is not necessary for us to do an exhaustive allergen testing for all the people with asthma who are reasonably well controlled.
So sir, apart from the triggers, are there any risk factors or particular group of patients who are more prone to asthma?
As far as risk factors for asthma is controlled, as we had discussed earlier, first is a genetic predisposition. So if mother and father have a strong asthmatic tendency, then their children are also likely to have symptoms of asthma. Second high risk group of people is what we call as an occupational asthma. So occupational asthma is something again which is common in certain parts of our country. For example, people who are working in the rice mills, or people who are doing farming with the cotton, or people who are into bird hatching, or who are actually bird lovers. So these are some of the occupations who are actually who are likely to develop what we call as an occupational asthma. And third is people who are, as a result of their occupation, exposed to dust. For example, there are studies which have shown that traffic policemen who actually stay on the roads for a long time and are exposed to a lot of pollution also are a high risk for developing symptoms of asthma or symptoms related to asthma. So these are some of the groups of people who we would call as a high risk group for asthma. But then many people without any risk factors also can develop asthma.
Do post your queries on this topic and we'll get them answered shortly. Moving to the next question, we've got Ms. Pallavi from Warangal. She wants to know, how do I know if my asthma is getting better or worse, and when should one seek admission for this?
For this question, we also have to understand what are the common symptoms an asthmatic person will have. So the common symptoms of an asthmatic person are cough, difficulty in breathing, production of phlegm, and chest tightness or wheezing. These are the common symptoms. So the simplest way how a person can monitor whether they are actually improving or they are worsening is to look at the frequency of these symptoms. So a person who is having symptoms regularly or having these symptoms at a higher frequency are those who are having a poor asthma control. And here also there are two groups, two things which you understand, the daytime symptoms and the nighttime symptoms. So both are important, the person who have daytime symptoms or people who have nighttime symptoms. Some asthmatics have symptoms more towards the evening or in the night. So the first simplest way for a person to monitor their asthma is to look at the frequency of their symptoms. Second thing which people can also do in their home is a small device called a peak flow meter. This is there easily available, and the peak flow meters are basically things which would measure the lung function. So it's basically a small device where a person has to blow as hard as possible once or twice in the morning and once or twice in the evening, and then they compare the peak flow. So if the peak flow, for example, is around 300 on one day, then in the next week it has dropped down to 200 or 150, which means that the lung capacity is coming down. The other things which people can do in their homes is the two things. One is the 6-minute walk test. This has been widely propagated in COVID, but can be used for any respiratory illness. So people can just judge the amount they are able to walk comfortably. So if the amount they are able to walk is coming down, then again it means that the symptoms are worsening. Lastly, oxygen levels. So most of the asthmatics have normal oxygen levels. If by any chance an asthmatic person starts to have low oxygen levels, then it definitely is an alarming symptom.
So, sir, in this pandemic, did we notice that asthmatic patients are more prone to COVID infections? Was there any correlation?
This is the thing which majority of people ask, not only for asthma but for every other disease. Am I more prone to developing COVID? So as far as COVID is concerned, definitely all asthmatics are prone to COVID. Everybody is prone to COVID. But it is not that people with asthma are at a higher risk of developing COVID infection. But if a person with uncontrolled asthma, that is who has moderate to severe asthma, develops COVID, then it is likely that they will have a poorer outcome. And as far as COVID and asthma is concerned, there are two more things which are there. The inhalers which people use for asthma, the inhaled steroids inhalers, it is also said that people who take inhaled medicines regularly, if they develop COVID, there is some protective effect also. So people who are on regular inhalers, they may have a milder course of disease. Third, there is also an effect of COVID on asthma control. COVID is a viral disease, and viral infections are an important trigger for asthma. So many people we are seeing where an asthmatic gets COVID, the COVID becomes better, but then their asthma becomes bad. So people with asthma who develops COVID, after recovery from COVID, many of them have persistent cough, more wheezing, more breathlessness, and more requirement of asthma medicines. So this is in short a relationship between asthma and COVID. There definitely you have to take care. They're not at a high risk, and COVID can worsen asthma control.
So moving to the next question, we've got Mr. Kiran from Bangalore. He says that he was recently diagnosed with asthma and he wants to know if he can travel to high altitudes or hill stations.
High altitude and asthma control. So how does it actually go? In general, it is said that an asthmatic who is well controlled, which means that who is having not much of symptoms, who is physically active, it is safe for them to travel to high altitude. But then we always suggest that they have to take the medicines regularly when they are going to high altitude. So what happens is, in some asthmatics, because of the cold air, because of the dry air, so it is basically said that the cold dry air can actually have a negative effect on the asthmatics. So some people with asthma can have an asthma worsening when they go to such cooler areas where there is dry air. On the contrary, there is another group of people where the cause of asthma is their environmental triggers, for example the pollution or the pollen or whatever it is. It is also said that on the mountains or the hill resorts, the air is much more cleaner, and the number of allergens or triggers are lesser on top of the mountain. So some asthmatics actually can have an improvement in asthmatic control when they go on top of the hill resorts. So basically we cannot predict a priori whether a person will actually worsen or can improve or have better symptoms on top of a mountain. So what is the best thing to do is they should have a written plan. So an asthmatic, when he goes to a hill resort or a mountain, he should consult the doctor before, and then he should have adequate supply of what we call as a rescue medicines, that is the inhalers which they have to take. Also nowadays we have what we call as a portable nebulizers, small nebulizers which are battery operated. People can also take this handheld battery operated nebulizers just in case of an emergency, and they can also have a sort of action plan for what to do if an asthma worsens, which a doctor can easily prescribe a couple of medicines which they have to start if in case they start feeling breathless. And then our aim in treating asthmatics is to help them lead their normal life. So unless until a person is having a very bad control of asthma, we would not stop them from going to a hill station or a mountain top.
So taking the next question, we've got Mr. Ravi from Hyderabad. He wants to know what is the effect of regular exercise on asthma.
As I have said, in majority of asthmatics, exercise is one of the triggering factor, and in a group of people, it is also called as an exercise induced asthma, which means the only trigger is an exercise. In asthmatics who have worsening of symptoms on exertion, or who are not able to work out or do their physical activity because of asthma symptoms, what we would suggest is to take an extra dose of inhaled medicine 15 to 30 minutes before their stipulated exercise. Suppose a person has to start their workout at say 6 o'clock, then at 5:30 or 5:45 we would ask them to take 2 puffs of their inhaled medicine, also called as the rescue medicine, and then this will help them do their exercise better, and then the person doesn't have an asthma worsening because of the exercise. So the aim is for all asthmatics to have a active life. So we would always recommend people to be physically active, to go for exercise. The only thing is that it is always safer to take a puff of medicine, 1 or 2 puffs of inhaled medicine before they start their exercise, and then they continue their exercise.
So sir, are there any lifestyle modifications that one should take up to prevent further attacks?
Asthma treatment, I think lifestyle changes is one of the very important things in management of asthma. Normally what I say to all our patients is 50% of the asthma treatment is medicines, and the remaining 50% is basically lifestyle modification. So by lifestyle modification, what we mean is basically trying to avoid the triggers. So this again would vary from person to person. So in general, what we normally tell is to avoid dust or areas with more pollution. In case it is not possible, to at least wear a mask whenever they go out, especially in metropolitan cities, a lot of pollution, lot of construction activity going around. So whenever you have to go to a place which is anticipated to have a lot of dust or pollution, we would always recommend them to wear a mask, which actually is also the norm now. So in COVID anyway you have to wear a mask. Definitely these masks will also help in decreasing the asthma symptoms. Second is to avoid changes in climate, sudden changes in climate. So most of the asthmatics will have an attack when they are exposed to cold air or cold climate. So whenever they have to go to a place which is cold, or they have to go out in cold air, we would also suggest them to wear warm covers and then protect themselves from the cold air. 3 is the indoor modifications which the people have to do. Again, this depends on the person to person. So the person has to modify their house a little bit so as to keep themselves better. So especially in India, I think the common things which people have to avoid, or people with asthmatics have to avoid, are having pets, having this floor mats and other things which are a trigger for asthma. Try to avoid these mosquito coils, agarbattis, whichever things can create an indoor air pollution. These are some of the things which they have to change. 4th, again very important, is to have a calm and peaceful mind. I think this is again very important lifestyle modification, because stress is an important trigger for asthma. Many times we would suggest them at least 30 minutes of meditation, yoga, something which can help them control their mind, decrease their stress. So this is a very important lifestyle modification which would actually, it is evidence based that having a peaceful mind, having a peaceful life will actually lead to better asthma outcomes. Lastly, medicines. So medicines are a part of their asthma lifestyle. Always important for asthmatics to have their inhaled rescue medicines along with them whenever they travel elsewhere. So I think that is a small lifestyle modification which they have to do, that they might have to take their asthmatic medicines along with them, either in the pocket or in the handbag or wherever it is. I think if you take certain precautions, all asthmatics can live a life as normal as people without asthma.
So this brings us to the end of this session. Hope all your queries on the topic asthma were answered by our doctors here. Thank you all for joining us, and we will look forward for your active participation onto the next week. Thank you and